Anatomy and Physiology of the Sick Child, Test of Knowledge. This learning unit focuses on the biological features of the child in relation to illness and compromise. The aim of this learning unit is to provide an overview of the implications of child-specific anatomy and physiology as relevant to when an infant or child becomes unwell. This unit and test of knowledge follows on from a previous unit, Understanding the Anatomy and Physiology of Children, and it's recommended that you work through this unit before undertaking the quiz that now follows. You can also refer to the resources listed on the next page, such as those listed here. These links highlight the unique differences in children as compared to adults in relation to the implications for when children become sick or injured. They provide a useful overview and background reading on this topic. The learning outcomes of this unit are to firstly understand how the specific features of a child's anatomy and physiology can affect how they present when faced with illness or injury. And secondly, to identify the relevant child-specific vulnerability and the unique considerations for their assessment and subsequent nursing care. Before taking the quiz, there are some notes to consider. Firstly, all the questions that follow refer to child-specific anatomy and physiology as compared to adults. The terms used in this learning unit: infant refers to a child in the first year of life, a child refers to years 1 to 8, an older child is over 8 years, an adolescent refers to a child 11 years and over. The term compromise refers to an impairment by disease, toxicity or injury. In addition, neonatal specific differences are not covered in this resource, but they are covered in a separate learning unit, and the link is given here. This first appendix highlights normal paediatric vital signs by age group. There's also a file at the bottom here from the Royal College of Nursing, which explains the standards for assessing, measuring and monitoring vital signs in infants, children and young people. Appendix 2 follows on from this and provides another look at the normal vital sign ranges in children, including identification of both tachycardia and tachypnea, i.e. abnormalities in the normal ranges for children. Again, the source of this information is indicated at the bottom. So on to the quiz. Having done some reading around this area, now answer the 16 questions that follow. Each question and the answer that's given give full explanations to aid your learning as you go through this test of knowledge. Best of luck.